Doctor, is it true that on average men have, I'm just asking because I'm not sure if this is true, less risk of heart disease caused from diabetes than women?
There seemed to be a trend in that direction. It is not clear, but there seemed to be, and I'm not sure why that is.
Sure.
But
Fair
there
enough.
is a bit less of incidence of heart disease in men than women.
And how does diabetes affect your vision? A lot of people sometimes hear that.
There are, well, the classic way is by causing retinopathy, which is one of those microangiopathic complications of diabetes. But it can also, when sugars are really high, the concentration of glucose is really high, it prevents the lens in the eye to accommodate, and you can see people having difficulties for nearside vision and so on, and that is then prevented or resolved once the concentration of glucose goes down.
Do you see that at all when you see some of the patients come in, that they're telling you these symptoms that they're feeling? I mean, it's got to be tough. They must personalize, open up to you and start telling you things that they're experiencing, and you come in not only as a fitness expert, but now you're a friend, right?
Absolutely, they do open up a lot. And one of the things that scares them sometimes is the fact that they can't see, or they can't drive. I mean, think about how much you rely on your vision. Even looking at the materials that I give them sometimes, it's very difficult for them to adjust when you can't see, and they go to the eye doctor and they're thinking something's wrong with their vision, but it's really the diabetes. So that's one way to kind of scare them into lifestyle management and say, this is going to happen.
Right.
You don't want to lose your vision. We need to get moving with prevention.
And how do you help them at that moment and reach out to them and say, hey, don't worry, we're here, and let me tell you why?
Well, what I like to do is I like to meet patients where they're at as far as their eating and their exercise, and then make adjustments and improvements from there. Make small changes that go a long way that they're able to adhere to. If I look at their eating record and I see that there's something that we just can't do, all right, let's focus on this one change first, and then we move on to other changes.